A 41-year-old man with a long history of alcohol abuse presents to the emergency department with several weeks of worsening shortness of breath and lower extremity edema. An echocardiogram shows biventricular chamber enlargement, increased systolic and diastolic volumes, and an ejection fraction of 35%. What is the most likely diagnosis? So this is a rather straightforward question. We need to take some of the information in the question and simply make the diagnosis of the four answer choices. And the four answer choices are A, dilated cardiomyopathy, B, hypertrophic cardiomyopathy, C, pericardial effusion, and D, pulmonary embolism. And the key here in this question, there's a handful of things. I'm going to point them all out, and then we're going to focus on what the reveal is. First, we have a 41-year-old patient, 41-year-old man in particular, and we see that there are several weeks of worsening shortness of breath and lower extremity edema. So shortness of breath, lower extremity edema makes me think a type of heart failure. And on echocardiogram, we see chamber enlargement, which is very important. And then increased systolic and diastolic volumes. That's fine. Ejection fraction is decreased 35%. So we have two cardiomyopathies, and the answer choice is a pericardial effusion, pulmonary embolism. But the reveal here is alcohol abuse. We're going to see why in a minute. Let's go through our answer choices. Answer choice A, dilated cardiomyopathy. So for dilated cardiomyopathy on exams, I always think about a few things. One, ischemia. Two, infectious. Three, toxic. And of course, you could get just idiopathic dilated cardiomyopathy. There's other causes of dilated cardiomyopathy, but we're going to put that on hold right now. Answer choice A, go through the other answer choices and come back. So answer choice B, hypertrophic cardiomyopathy. All right, for the sake of exams, almost all the time you will see this associated with a young man, usually in his teens or 20s, maybe 30s, who has a syncopal event while playing sports. Right? That's the classic presentation associated with an autosomal dominant condition. But one of the main differences with hypertrophic cardiomyopathy is this is a impaired diastolic filling. So instead of biventricular chamber enlargement, you're going to see something on echo that says asymmetric septal hypertrophy, and you may see impaired diastolic filling. So not what we're seeing here. We are definitely not having a hypertrophic cardiomyopathy here. So I'm going to cross this off, answer choice B. Let's go to answer choice C, which is pericardial effusion. Here on echocardiogram, we would have seen pericardial effusion, right? And there's no mention of it here. The other thing is this is also associated with a diastolic dysfunction as more and more fluid accumulates around the heart and leading to tamponade. So I'm going to mark answer choice C as not the correct answer. Then we go to pulmonary embolism. Pulmonary embolism most likely would present in an acute type presentation. This patient's had several weeks. Still could see that in pulmonary embolism, but we're seeing classic signs of heart failure here with lower extremity edema, shortness of breath. And on echocardiogram, we're seeing pretty classic signs of heart failure. As far as exam taking, we are given 0 risk factors for pulmonary embolism. And when on an exam, if you're not given any risk factors for a condition, it's very unlikely that it's going to be that answer choice. So I'm going to cross out D, pulmonary embolism. That leaves us with dilated myopathy here. And the reveal for dilated cardiomyopathy, like I said, on an exam, whenever I see a middle-aged individual or so here, 41, a little young, with alcohol abuse, and there's signs of heart failure, I always think dilated cardiomyopathy. Other causes, but frequently on exams, this is what you're going to see. So let's choose answer choice A and click next. And sure enough, dilated cardiomyopathy is the correct answer. Hey everyone, before you go, if you're interested in your own QBank, whether you are an MD or DO, a PA, or an MP, simply go to roshreview.com and sign up for a free trial. See if Rosh Review's content is right for you. Keep learning, keep working hard, and always have a sense of mission about your work. Now is your time. This is Dr. Adam Rosh signing off.